about a lot. But this morning, we basically want to keep the testing is the big thing, obviously, and kind of getting everybody up to speed with where we are locally, and then what we're looking at as far as again, trying to promote the vaccination and try and get through this. So.
If it works, that's what I do.
You need a pen?
I brought two.
Glad to help you out, Mr. Spalding. I hope it works. All right, it is 8:30. I'd like to welcome everyone to the resumption of our COVID press conferences here in the county. We got through the summer. Here we are, September 1st, and we've certainly seen things change locally. Our group here, our local group, the county, the health department, our testing partners, the Bowen Center have been meeting for 3 weeks, keeping up with the numbers and the situation, and felt it was important to answer questions and make a presentation this morning about just where we stand currently in our county. So with that, I've got Dr. Bill Remington here, our health officer, county health officer, Carrie Groninger, commissioner, Gamal and Kurt from the Bowen Center to talk about our testing issues. And I think I'll start with the only thing I really want to say is that, obviously we know that our advisory levels seem to be kind of heading the wrong way. We know our testing is up. I just saw on the state website that Delta variant makes up 97.6% of the cases in the state. So obviously something's going on. And to dissect that further, I'd asked Dr. Remington to give us an update on where we stand today in the county.
Sure. Well, thanks, Mayor, for inviting the Health Department again. So let me keep with a framework that we've used in the last few months with these press briefings. I'll give you kind of our cases, where we are with immunization status, and then some bullet points on emerging topics regarding COVID. So most of this is Kosciuszko County specific data. Our first case, to remind us all, was March 26, 2020. Since then, now we are up to 10,450 cases from our county. When we last had our press briefing on May 26th, it was 9,500. So it's growing. We have 128 deaths in the county now. We were at 117 on that May 26th date. So a little jump here through the summer. Condolences to those families. The State Department of Health's advisory color-coded map brings us to orange for our county, which is a couple notches worse than we were when we last met in May, where we were blue. Our orange advisory level this week is the same as last week, and that will be announced publicly later today. Our positivity rate is at 7.8%. That's a 7-day rolling average. At our worst in November, we were 26%. We were 3.4% on May 26th. We had not seen this positivity since January or early November, kind of the shoulders of that mountain we saw late in November. We're averaging 35 new cases daily, 134 for comparison in November, 3 in May. So 35 now. 217 weekly cases per 100,000. That's a metric the state is now watching and measuring, and that folds into the color-coded map. A month ago, we were 59. So 217 weekly cases per 100,000 population compared to about a month ago, we were around 60. So a substantial jump. Hospitalizations, not only here in our community, but District 2, District 3 in the state, that's South Bend leaning and Fort Wayne leaning, are all significantly up. The statewide hospitalization graphic, if you turn to that on the state's dashboard, is impressively up. When we last met in May, it was down. Okay, so that's was a key metric, at least in my mind. How are we doing with disease burden, hospitalizations are the most nimble to watch if you have a tool to watch that. Deaths are a late coming indicator. It takes a little while for those to occur, but we're up. They're coming up nationwide in the state of Indiana. Our 7-day moving average is now 17. We were 100 in November. We were 10 when we last met in May. So deaths now are coming up. And watch for that, not to be a downer here, but the deaths always are a lagging indicator, so those will assuredly go up in the next month. So that's where we are with our cases. Vaccine. So state of Indiana is up to 6.2 million doses total, 5 in May when we last met, 3.1 million fully immunized, 2.5 million fully immunized, so we're creeping up. Kosciuszko County, 27,000+ are now fully immunized, 27,621 per the dashboard this morning early was our count. That's up 5,600 doses, or 5,600 people since May. So that's good. I mean, right? Several thousand more have been fully immunized since we last chatted at the end of May. So that was good. Of the population of this county eligible for immunizations, that is 12 and older, per the state's dashboard early this morning, it was 41%. For our county, we were 33% at the end of May. So again, good. Our health department doses, we've lost track a bit, but we're over 22,000 doses now, I'm sure. We're averaging, I think, still around 100 doses a week. Had a great immunization mobile site collaborative effort this weekend, thanks to many people in this room who facilitated that. That was a wonderful thing to pull off. And I believe it was 130 some doses over that hot morning. So lots of effort went into doing that. So that's where we are with vaccines. So some improvement. So thank you, Kosciuszko County, for rolling up your sleeves and more people being immunized. We're creeping up. Still not probably the banner county for the state, but we're for a rural county, we're kind of holding our own. I'd like to see more. So emerging talking points. I would ask anybody who cares deeply about this topic to take the time and look at the State Department of Health, Indiana State Department of Health's media briefing this past Friday, August 27th. Dr. Box, the health commissioner, Dr. Weaver, the chief medical officer for the State Department of Health, were very forthright, very concerned. Probably the deepest level of those two things I've seen in their faces with a press conference this whole pandemic. Only about half of eligible Hoosiers have been immunized, so even though I'm encouraged to see some immunization more in our conservative county this summer, we really need to see more. The Pfizer vaccine now has full FDA approval for 16 and older. And I don't know how that resonates with people, but to me that was a boost of confidence that we're on the right track with vaccines. So the story really is about Delta. This, as the mayor mentioned, Delta is now almost 98% of those cases genetically sequenced in Indiana. Delta's 98% of them. It was only 1% in May. All right, when we last met. More cases, right? We heard that early. You know, India had a horrible experience with Delta. Very contagious. The viral load is extremely high with this. And then there's been this bumping around conversation. Is it more virulent or not? Is it more aggressive potentially, case by case or not? And that's gone back and forth. But just in the last 2-3 weeks, the voices are getting louder that it is more virulent. It is potentially more aggressive case by case. The pediatric side is raising eyebrows, and that had not been the case with the so-called alpha back in the winter. If you listen to that press briefing and other venues I've seen with them discuss just in our state, Riley, the banner pediatric hospital for the state, is really feeling this. Pressure on healthcare facilities on the adult side is very significant, locally, regionally. Calls out for volunteer staffing to come in after hours and give a little more time, help out at the bedside. People sitting on gurneys in the halls again. All right. So I'm just telling you, this is a real thing. Wouldn't have predicted it. I cannot predict this virus. I've been bad at that. And this is really bad again. Okay. And to listen to Dr. Box and Dr. Weaver talk about this on Friday, they were very clear the worst is yet to come. There are some reinfections and breakthrough cases. That is, if you've had a previous case of COVID, you can get it again. If you've been immunized, you can have a breakthrough case. Those are real things with Delta. It's still statistically a minority, okay? So immunization is a good thing. So layered mitigation is the talking point. You'll see this again and again if you look at any public health motif. Vaccination is the first thing in the line of things to follow. Masking, distancing, hand washing, ventilating rooms. If ill, stay home. But vaccination is number one in those lists every time. School masking, a hot topic. We're not delving into school policy today. You'll hear Dr. Box at that news conference mention her impressive take on Duke University's study in North Carolina. That was the last, I think it was 10 to 12 weeks of the school year in North Carolina. Over 100 school districts, 1 million students looked at. That's a lot. And so COVID was really coming into that equation the last month or so of their study. And despite that, they did show that universal masking seemed to have legs. It really seemed to have legs. Such that, in their opinion, it trumped this nasty quarantining thing that we do with asymptomatic contacts. If everybody's masked, the stronger thing is the masking, even more so than the distancing and the quarantining. So anyway, look at that Duke University study. That was at the end of the summer, or the end of the school year, published, I think, in June. The CDC's MMWR, that's Morbidity and Mortality Weekly Report, I've always been a fan of that publication. Their publication of 5/28/21 looked at Georgia and over 100 reporting schools, as I recall. They make a strong case for masking. That was looking back into November, so Delta was not a thing then. So it's not fair to say how masking, if you look at that study, that would be one of the critiques. It doesn't look at Delta. The Duke University study doesn't compare optional masking or no masking versus masking, so that would be a criticism of that study. But it's the size of that study, the sophistication of them putting that together is very impressive. So that Duke University study in North Carolina is fairly recent, does involve some COVID experience, so take a look at that if you're so inclined. So our bottom line is immunize those who are vaccine eligible. Despite some disappointments, it's still your best deal. Go to rshot.in.gov or call 211 or show up at your pharmacy, see if they'll take you as a walk-up. We're pressured at the health department on many fronts right now, but we're trying to accommodate some walk-ups. We'd prefer if you schedule ahead. We're still giving vaccines at the health department. We're depending largely on pharmacies, though, right now. So Delta's a real thing. Immunization's still worth it. Even if you think you had a case, even a single dose of one of these messenger RNA vaccines, the data is really compelling. It really substantially boosts your neutralizing antibody levels. So get a shot, please. Thanks.
All right, thanks, Dr. Remington. And just to piggyback just a little bit on your mention of the vaccine clinic that we had last Sunday, I do want to publicly thank the Warsaw-Wayne Township Fire Territory, who was out administering doses. Thank Our Lady of Guadalupe Parish for hosting that event. The Northern Indiana Hispanic Health Coalition was a big part of promoting that. Obviously, the Bowen Center, their volunteers were there. There were plenty of other volunteers. I'm not sure. They just came. We needed interpreters, and we had a great clinic. So thank you. Again, I would just echo what Dr. Remington said. It's our safest, most effective, strongest intervention means we have to try and eliminate these variants. So again, thank you for that vaccination clinic. The city fire territory is still offering mobile vaccination clinics. If an industry or group would request that, they can contact the Warsaw-Wayne Township Fire Territory, and we'll set up a mobile clinic. As Dr. Remington mentioned, the pharmacies are providing vaccinations, as well as the clinic, the K-21 Pavilion. Registering is probably the best for the majority of those, but if you're compelled, I'd get it done. And if you, again, feel like you could host a mobile site, city would be glad to help with our fire territory. Pivoting a little bit to testing, we've certainly seen a significant rise in the testing locally, and again, looking at the state website, it pretty much mirrors what's happening all over the state. We had responded last week by increasing the hours of the testing site, and I think Kurt is going to share, Kurt Carlson from Bowen Center and Gamal Hernandez are going to share some information on what they've seen and what they're going to do.
Yeah, thank you, Mayor. And I think there in front of the two reporters is a graph that clearly depicts what's happened. So over the summer, we just had a handful of people per day, so we staffed down to about 1.5 persons working in the test site, and they were able to keep things going. But as you see, this has dramatically increased from just maybe 10 a day to 161 yesterday. And I drove past the fairgrounds when they were open, and the lines are long again, snaking through. So Gamal has been authorized to go ahead and add staff. He's recruiting them. One of the persons who had worked for us and moved on is now coming back. He's interviewing somebody else this morning that is probably a good candidate, and we'll start. So we're ramping up, and we'll be expanding hours. They have really been working overtime, so to speak, and keeping up with the demand. And so even though the test site goes through its hours, if there are still people in line, Gamal and his people will stay and do the testing until the line is gone. So that said, we believe that we're going to need to expand the hours as we have the staff. So beginning very soon, we'll be open Monday, Wednesday, Thursday, and Friday from 9 to 3. And then the staff will spend a couple hours after that entering the data, because with the rapid tests, you can't do it as quickly as you do with the deep nasal swab. Tuesday, we have some evening hours, so that'll be noon to 6 p.m. And then Saturdays, we're expanding from one Saturday a month now to every Saturday, and that'll be 10 to 2. And again, we'll adjust this as the demand either continues to increase or decrease. And we'll just pay attention to that and staff up or staff down. But those will be the new hours. Gamal, what do you think, after the holidays?
Yeah, I would say that, that will be the best for right now. Those hours will be great, into the holidays.
So what do you think, starting next Tuesday?
Next Tuesday, yes, please.
Okay.
So, yeah, we'll be closed on Monday.
Yep. So again, it's a privilege to serve the community, and it's disheartening to see this happening again. But at least so far, we're not up to the 400 tests a day that we were doing at the peak early on. But at the rate it's going up from 10 to 161 a day, we could get there, I suppose.
Kurt, certainly appreciate Bowen Center, our testing partners, pivoting as the demand is obviously skyrocketing. And I know the county and the city both are fully supportive of obviously those increase in hours, and we're working to help fund that as we need to. I know these testing is funded primarily by the state, but with the demand, the support by the state is probably not enough. There is a gap there, and the city and county are committed to meeting that gap as we navigate through these ups and downs in the demand for the testing. So with that, I know Commissioner Groening is here from the county. Carrie, anything you want to add to discussion this morning?
Not a lot, just, that we're here to support, staff, whether it's Bowen Center, the health department, Dr. Remington, just to make sure that we're giving them the resources that they need, whether it's people or monies to do what needs to be done to continue to move our community forward. So we want to make sure that we're making sure the testing is available and vaccinations are available for those who want them. So.
All right, thank you. Any other comments before we open it up to the press for questions?
Yeah, I can just mention, to remind people that we are still doing the testing for school systems. School systems don't have the staff to do it themselves, and so they're referring over to us. So we're testing the kids and the faculty that the state would expect the school to do, but all the school systems in Kosciuszko County are referring their students and staff to the test site, and we're glad to do that for the schools.
Kurt, you might have mentioned it, but you are offering both the rapid test. Could you expand on that?
Yeah, originally the state wanted us to do predominantly the deep nasal swab, and then sometime over this past year, they loosened up more on the rapid test. And now they're even saying that there's no distinction between the two in terms of the validity of the results. And so we're actually doing a lot more rapid tests. That's predominantly what we're doing now. But yes, some people are still required to have the deep nasal swab, and we do those also.
All right, thank you. So with that, members of the press, are there questions?
Yeah, my first question was, with all the numbers kind of going the wrong direction, is there going to be a mask mandate either countywide, citywide, or maybe for county and city employees? Or is that a potential mask mandate again?
I would just say we're considering, we're keeping an eye on the numbers, and obviously as the weeks progress, we're probably getting closer to having to do some type of restriction. I can't fully tell you what that is yet. I do tend to feel those folks that have been vaccinated certainly make this, it's kind of a double-edged sword. Everybody's, we feel like that defenses of the vaccination are critical and very important and are a big part of this. But it becomes a little more difficult, I think, when not everyone's been vaccinated, and I'll just leave it at that. So from a city perspective, we're certainly considering, but have not made any decisions on that.
Dr. Box on Friday, I believe she expressed concern that schools have not continued to update the state health department as they have been.
I've heard that. I think we're doing really well in this county, but I heard that too, about 1,200 schools not reporting to the state. The state's trying to do something through the Department of Education to strong arm that a little bit. I don't know where that's going to go.
So earlier, last year and into the spring, from what I understood, the local schools were working very closely with the health department. Do you still have that? Is that parallel still?
Yeah, I think we do have great input from nearly every school. we are trying to muster the forces to engage with them as we would like to. I mean, we're feeling this just from a staffing perspective at the health department right now. There are other communicable disease issues that we have to address for the state. It's not just COVID for us, so. But we are engaged. We've tried to make it an administrative priority to engage strongly with the schools, certainly when they call us, to guide and direct them in their thinking, to come alongside their school nurses. We are not proactively, I'll admit, going out to each school that we haven't heard from to ask how's it going. We just don't have the staffing and resources to do that.
But Doc, didn't they, before school started, I know that Teresa went out and trained a lot of the school nurses.
Right.
A lot of that stuff. So, I mean, there is some proactive things that.
Oh, thank you. Of course.
We're
Right, as
doing
we
a
were-
lot to try and help.
Right, ramping up to the school year. Teresa did that. I met with the school leads for the large school districts in our county, met with them at the courthouse for a couple hours, framing up how we were going to look at the start of the school year. So we've remained engaged with schools as a county health department. Yeah.
There are a number of community events coming up, like I know on September 11th, there's a variety. Should some precautions, what kind of precautions, I mean, what
Yeah.
they've been doing, or should they be more?
Yeah, I'll be honest with you, I just haven't personally gone there in my direct, strong voice yet. I think people have had enough of that. I think the outdoor venue, in my thinking, is so much better than crowded indoor venues with poor ventilation for hours. So sure, if you're cheek to jowl, packed in, some rock concert outside, everyone's screaming, yelling, nobody masked, 20-something-year-olds, we know that's a large demographic stirring this around right now, that I'd be a little nervous about that too. But the casual walking between booths, on a street somewhere or in a big lawn, breeze blowing, nice day, I would say that's probably not the lowest hanging fruit to grab and mess with in our public health voice. Indoor crowded venues are still the most respectable thing. And still the social settings, just we all love at home, sitting, sharing a meal at home, Intra-family spread is still a substantial source of community transmission.
Dr. Remington, I had a question that was passed on our Facebook audience, and the viewer wants to know about the safety/risks
Yeah.
of vaccines for kids. She's hesitant for her 12-year-old.
Yeah, I get that. The risk versus benefit equation is always how we should be thinking in medicine. It's never perfect and many times not perfectly discerned. So back in alpha days, I would say, boy, the kids just don't look to be getting sick at all. I mean, if there's any hint these vaccines are stirring up substantial myocarditis, I tell my patients in the office, it's worth pausing maybe a little bit. But now comes Delta and this not quite sure how to quantitate the severity of illness in kids. There's increasing voices about that. So the myocarditis is probably the big issue with the younger recipients of the vaccine. And what is that? I mean, are we able to detect it? Are the very subtlest cases being detected with our public health safety net? There's maybe not. The most obvious cases are, and I think they're quoting around 30-some cases per million doses. Again, largely younger recipients of the vaccine. But now comes Delta, and the case severity index may be going significantly up, more kids getting hospitalized. So I think if I had a 12-year-old in our household today, I would take them for a vaccine. An FDA emergency use authorized Pfizer dose would be offered. I would do that with my child or grandchild, if their parents let me. But it's a tough discussion. It's worth discussing openly with their primary care physician. Stay tuned to that myocarditis topic. It's a tough one.
All right.
Yeah.
I received a call, I think it was sometime last week, from a woman who said all the local hospital beds were at capacity, there was no room. I don't know if it's true or not. And then I read the another article yesterday that says, if children get the virus, there's no room for them in hospitals. What's the local, I guess, hospital situation as far as bed capacity?
So our hospitals accommodate patients. I can't quote on behalf of any of the hospitals in our immediate region if they are diverting elective cases right now. That had been a strategy back through the winter. Very painful for hospitals to do that. I don't think anybody's going there very quickly at all this time. So they're trying to get the usual course of business done, and now comes Delta. So it's tight. But if you need care, go to your local hospital and seek care. If you can remain an outpatient, certainly start with your primary care resources available to you.
So what is being done then to help?
Sorry, who are you?
I'm sorry, my name's Eileen, I'm with ABC 57.
Okay, thank you.
And I was just wondering what is being done to help with this situation in the hospitals?
Well, they're staffing up. I know I can speak for KCH. The call is to just get more staff in to help. And they've been successful with that. So if someone's on a gurney in the hall, they try to minimize the length of that. I mean, that happens in a lot of hospitals periodically. You try to get it ready for them pretty quick. So we're kind of feeling that. I mean, it's not just KCH. I think the other regional hospitals are feeling that too. Hearing Dr. Box talk about this, Dr. Weaver, last Friday, they were hearing across the state of hospitals diverting care again. So.
Yes, Mr. Spalding.
As we are here today, are you in a more difficult position because generally the public doesn't have an appetite for what we went through?
Yeah. May I answer that? Is that
Please.
okay? Just let me give you some anecdotes from my office. I had 2 or 3 COVID cases last week. One was a telehealth visit with a pretty ill patient, middle-aged. I mean, could hardly get her head off the pillow. She was sick. It couldn't be COVID. Just couldn't be COVID. I had the mother of a teen in later in the week. That kid could hardly keep his head up. He just wanted to lay down constantly on the exam table. I mean, not critical. I didn't have to admit him, but he wasn't feeling very good. And we tested him in the office. He was positive. It just couldn't be COVID. It just wasn't going to be COVID. It can't be. And that's the thing that's spooking me. I think, to your point, it's just not in their calculus anymore. Now, that's polarizing. But there's a substantial cohort population that they're just not going there in their differential diagnosis in their minds. They have to be really smacked up against it right in their face that this indeed is COVID. And the reason I say that is they're out there mixing it up. Both these cases, they're out there going to work before they got horrible, or going to school before it got horrible, because it wasn't COVID. It just couldn't be COVID. And that spooks me a bit. And I think we're going to feel that in our schools here. We already are, I think, to some degree, from the conversations I've been hearing this past week. I think that's going to be a substantial issue in the next month. So, yeah.
Well, despite your lack of confidence in predictions, what's your prognosis? Is it just...
Well, let me just lean into what Dr. Box, Dr. Weaver said on Friday. They really felt the worst was to come yet. And that's why they were so sobered in their temperament in that press briefing. So we haven't hit the peak yet. We're seeing the numbers that were the shoulders of that horrible peak in November. We're at those numbers right now, about halfway up the mountain slope on either side, maybe a third of the way up. So the question is, are we going to get to that mountain peak again here in the next 6 weeks? I don't know.
you talk a little bit about boosters? I know some people.
Yeah. Yeah, I'll be happy to. That was actually one of my talking points I didn't get to. Thank you. So boosting and versus third dose. A little semantics here, which is unfortunately confusing. So third dose is offered now for one of the messenger RNA vaccines if you are immunocompromised, and that's a pretty long list of who's considered immunocompromised. People look at that. But if you consider yourself immunocompromised, go get a third dose of one of the messenger RNA vaccines now. Try to stick with the same brand you had, but if not, it's okay. You can mix it up. What will be coming is a booster dose recommendation, which, if you had the messenger RNA vaccines, also is a third dose, but it's a booster. And the strategy there is several months, so that the third dose that's recommended now needs to sit at least 28 days after dose number 2. And that's to just be more confident with the prime, okay, those 2 first doses, because immunocompromised may not take so great to that prime. So boosting is different. That's what you do several months out. Timeline goes on and you want to boost. And that's what looks like it will be coming with these COVID vaccines. The messenger RNA vaccines, I think I'm hearing 6 to 8 months out. The J&J vaccine, the vector vaccine, will probably have a booster strategy too. I'm not sure what they're thinking with that. So those of us who are immunized but not immunocompromised should get that booster dose. Look for that. It may be a product that is a little different. I'm hearing mixed messages on that. So don't just run out now, everybody, and get a so-called booster of your previous vaccine. If you're immunocompromised, get a third dose. The rest of us, wait just a bit and watch that guidance come to maturity from the CDC and the Advisory Committee on Immunization Practices to the CDC.
Dr. Remington, is the booster strategy the result of these variants, or is it just they're finding that the effectiveness of the first 2 doses, they're learning as they go
Yeah,
along?
well, obviously it's learning as you go. And that's, so number one, that is not unusual with vaccine therapy. Let me just give you a little anecdote. When I was at Ohio State as a freshman, there was a nationwide outbreak of measles. All of us had gone to college with 1 dose of a measles vaccine 10, 15 years before, me included. But there was a national outbreak of measles, immunized kids, college kids. And it was at that point that they realized you need a second dose. And we do 2-dose strategy to this day. But that was, took a while to see that. So that's vaccine therapy. Sometimes you just don't see it right up front. So here we come now with COVID and the latest variant of concern, Delta, which has really unearthed this issue. It's very clear there are breakthrough cases. And so the booster dose really raises neutralizing antibody levels, really brings it up substantially. If you've been previously ill with COVID, maybe had a brushing case, wasn't real severe, even a single dose of a messenger RNA vaccine really boosts those neutralizing antibodies. I mean, impressively to those who study it. I've read so many who have studied this, really impressed by that. Again, the immune system's more than just the measurable neutralizing antibodies, but that is a key thing to watch. So boosting is good. It's okay. Please seek a booster dose. Don't consider this a failure of vaccine therapy. That's not the way I think. Someone entrenched in vaccine strategy for decades. I don't see that at all here. Very successful vaccine, just needs a booster. The variants of concern will be an issue. So we need to find strategies to safely make this population less naive to this novel coronavirus and any future variants. You do that through natural means from infection, that's clear. You also do it with immunization therapy, which is safe and effective. Science had a recent article that Teresa passed along to me just this week, great article, talking about natural immunity, which I wish would get more discussion from the CDC. It's a real thing. But I love this comment, don't try this at home. That was good. Yeah, I mean, don't take out your life or someone you love to have a COVID party and catch the infection. That's not the point. Natural immunity is a real thing. We need to get this population less naive. We have great vaccines now. Take advantage of it if you're age eligible.
All right. Anyone else?
Is there a chance another variant?
Oh, sure, there'll be more. This will go on and on. But our population slowly should be less naive in general to the whole cadre of these novel SARS-CoV-2 family of variants. Now, if there's a SARS-CoV-3, a major shift, just like influenza shifts, a novel strain, then the game all changes again. But these are little drifts, just like influenza does this too, right? Drifts. We are so sophisticated with our genomic understanding. We really dissect this out so quickly. It's amazing. But that's what these pathogens do. The population will be less naive one way or another over the next several years. My prediction, here we go. My prediction is the depth and width of the beast footprint, no matter what we do, will be different several years from now than it is now. Because the population, one way or the other, will no longer be as naive.
So is this new normal?
Well, certainly that's part of the discussion. Yes, you'll see that, you'll read that. Right, of course. I mean, it is. We'll have, I mean, there are emerging pathogens all the time. This one was a big, big one, and still is. It will be part of our new normal. Not to be fearful of it, but just to realize, yeah, I'm not going to suggest that we all go around with masks forever. No. But this is our microbial world. It does this. Yeah.
Okay.
Do you guys plan on meeting regularly again like this?
Well, we continue to meet regularly as far as press conferences. I anticipate as these numbers appear to be in an upward push, we'll probably have another press conference. I'm not prepared to say that we'll go weekly, but there's probably a good chance, and we'll let you know probably next week if we're going to be back here again next Wednesday or the following Wednesday. But again, we're keeping an eye on the numbers and keeping an eye on things locally. And I just want to reiterate a little bit what Dr. Remington said. I think the concern that I share with him are these not so much the outdoor gatherings and so forth, but you know, the closed indoor, tightly, very dense groups that get together is where this thing can spread. And if indeed the Delta variant is more virulent and more communicable, you know, I think that's what we need to kind of focus. If we're going to make any of these restrictions, we need to focus on that. But again, that's all not been decided yet. Any final comments, gentlemen? Testing, you guys, can you repeat those hours and when they will be, just so everybody is aware, please?
Assuming we're successful at staffing up, and I'm fairly sure we will. So then, starting next week, Monday will be closed. Tuesday will be the one day of the week where we have the evening hours, and so that'll be 12 noon to 6 p.m. And then the rest of next week, Wednesday, Thursday, and Friday, and weeks following that will be 9 to 3, that people can come and get tested. And then we're going to start opening every Saturday, starting not this coming week, but the following week, 10 to 2.
So there are no Monday hours?
I'm sorry, I'm sorry. So after that, it'll be Monday, Wednesday, Thursday, and Friday. Thanks for the question. 9 to 3. And so it'll be 4 days, 9 to 3, 1 day, 12 to 6, and then every Saturday, 10 to 2. And just depending on the demand, we'll keep adjusting. We keep the sign business going, it's changing all the time.
I have a quick question. Do you see like repeat people getting tested? Or-
Yes, we are.
Yeah.
Yeah, especially from the school, people who work for the nursing home, you know, they come kind of weekly basics. And some of the schools staff, you know, they come on a regular basis to get tested, you know. So they know us by first name, and we know them by first name too, so.
Do you have any idea what percentage of, say, all the people who got tested yesterday, what percentage of those are students?
Actually, are we going to have a press conference next week, you think?
Well, good potential, we will.
Okay, we'll have all those numbers. We've got them. I don't have them accumulated. We have the numbers, and I think we're going to have a more complete report broken down by number of people who come symptomatic or don't, age breakdown, things like that. So, and if not, we'll have them for you at the next press conference. But yes, we are beginning to keep more data. In fact, Bob from the Health Department asked here, I think about a week ago, several questions that we had not been keeping that data at all. And so Gamal and his staff are now keeping that data, and so it's a matter now of formatting reports so that I can answer your questions. But we're accumulating in the data, and we'll have it for you soon.
So obviously, that's the state and county health department testing clinic. It's free. Those are the hours. I've asked Dr. Remington to just kind of review other options for testing in the community, I believe.
Sure. Urgent care centers offer testing, and increasing numbers of primary care practices offer testing on site. So if you have a primary care medical home, a family physician, pediatrician, general internist, you might call that office first. Sometimes they can see in a telehealth format and figure out your testing, or bring you into the office if they're comfortable. And as I did last week, increasingly was personally doing the swabbing, and we ran a rapid antigen test in the office, just trying to take the burden off the queue. So last winter I was sending everybody to the queue, either you or MedStat, and we have the kit now in our office, and I thought, oh shoot, I'm just going to start doing it. I know how to get an NP swab, and we just started testing, and that was so. I know other offices are doing the same thing. So there are other places to get tested. It doesn't all have to funnel through the Bowen Center's publicly funded testing site. And we're going to need that. The pressure on that is tremendous right now. So.
Okay, I did want to mention another thing with regard to the vaccination clinic. I had mentioned loosely the county. The county played a big part in it. I know Bob Weaver did the yeoman's work of kind of getting this thing organized as well, with Jeannie out at the K-21 clinic kind of managing the doses. And, you know, to walk up clinic, that's a tough thing to do, to try and have the appropriate number of doses without wasting any. So kudos to them. And I certainly didn't want to shortchange their contribution to that clinic. So. All right, I think that's it. Appreciate everyone coming this morning, and we'll certainly be in touch. As mentioned, we do continue to meet and communicate regularly, and if there are changes, we'll probably continue. We will continue these press conferences. I'm just not ready to announce when the next one will be. So, all right, thank you all.
Thank you, Mayor.
Thanks.
Thanks.
Maybe you guys are